Hi, this is Ely Moore. Welcome to my talk show. And today we have a very special guest, Dr. Carol Clark. Dr. Clark, welcome to my show. Can you please introduce yourself? Tell us a little bit about who you are and what you do.
Hi, Ely. Thanks for having me. It's such a pleasure to be here. So my name is Dr. Carol Clark. I'm a licensed mental health counselor and a certified addictions professional and a certified sex therapist, among a few other things. I have a private practice where I practice sex therapy, and I now train other therapists in the fields of sexology, addictions, transgender care, kink conscious therapy, sex offender therapy, and hypnotherapy. So as I've gotten older, I like to pay it forward and really take all my experience and practice and help others to pay it forward, to work with others in this field. So you may be wondering, what is a sex therapist and how do you get to become a sex therapist? So I'm going to tell you a little about my journey. I started out life as the child of an alcoholic, and so I had a really bumpy road in the beginning. And throughout my 20s, I was bouncing around, but I always came back to some kind of helping others. I got into helping addicts. I got into being a house parent, and generally being a counselor, but not yet educated. By the time I hit my 30s, I decided I need to get serious about what I want to do with my life. So I went to school, ran through, got a bachelor's degree in psychology, a master's degree in counseling, and started my career as a mental health counselor. And then I was exposed to this wonderful, wonderful person named Dr. Marilyn Volker. She taught me a human sexuality course that I had to take. Now, this was really interesting because sexuality is something that is part of all of our lives, even if you're not having sex. Okay? It's still part of our lives. Mm-hmm. And the idea that somebody could be a counselor and help people with their personal problems and not have any education in sex therapy, human sexuality, is just ludicrous. And yet, many states, many schools do not have that as part of their curriculum. And so my curriculum in New Jersey did not have that. So I came out of my school as a counselor, but I moved to Florida to start my career, and Florida insisted that I take a course in human sexuality, which I did, and I took it with Dr. Marilyn Volker, and that set me on my path. So her program at the local university introduced me to many things around the field of sex, but including transgender care and transgender people, which was completely foreign to me. And I decided I want to specialize in that. So under the umbrella of sex therapy, we have many separate areas, and transgender care is one of them. As I moved forward with my career, I became a certified sex therapist, and then I went and got a doctorate. There's very few people, very few places that offer doctorates in sex therapy or human sexuality. And one of them was an institute in California that's no longer there, the Institute for Advanced Study of Human Sexuality. And that's since closed down. But that's where I got my PhD. And now I have a school that offers a PhD in clinical sexology. So,
which I attended to.
Yes, indeed. And I got the PhD. I also got certified in addictions therapy. And that was real interesting because I started out my career, as I said, I was the child of an alcoholic, and I was angry and didn't like addicts. But the universe kind of drew me to this field. I forgave my father. We became close in his later years. And I started working with addicts and got certified in that field. So between the sex therapy and the addiction therapy, I began realizing that there's such a thing as sex addiction. And I started working with sex addiction. And then I came to the realization that addiction isn't about addiction to drugs or addiction to sex or addiction to alcohol or addiction to one thing, except stimulation. We get addicted to stimulation. And I realized as I was seeing couples who were coming to me for sex addiction therapy that I was formulating a conceptual framework around the treatment of addiction and recognizing how addiction permeates all aspects of our lives and interferes with relationships. So addiction is a barrier to intimacy. And I was starting to say the same thing to all the couples I was working with and then all the individuals I was working with. And I said to myself, well, I need to write it down and make a book so I can just give people the book. And so in 2011, it took me several years, but in 2011, I published my book in English, and then I published it in Spanish. And this book, this one simple, thin book, really contains everything I do in therapy. All the conceptual framework explains what happens to our brains that interferes with, that leads to the path of addiction. It explains how that interferes with relationships and then what we can do about it. So it has some exercises, it has some, educational components and some good stories. It's an easy read and it's good for everybody. It's good for the general public. It's good for therapists to use with their clients. It's good for clients. It's good for everybody. So that's that. I'm working on a couple of other things. But that's how my life has progressed. I've really become an educator. And, so like I said, I have all these schools. And I trained Illy. She took the sex therapy program. And did you take any of the other ones yet?
Not yet.
Not yet. Okay. All right, we'll work on that. So Illy was, of course, one of my best students. Oh. And is now taking her career along the path of relationship coaching, mm-hmm. right? Mm-hmm. And because sex comprises a lot in relationships. However, one of the things I want to say about sex therapy is sex therapy. People who come to see me for sex therapy or sexology, sex coaching, relationship coaching. It's sex is a symptom. It's really about the relationship. It's really about the intimacy, the loss of intimacy, the loss of connection. I don't know if you saw this book, but it's Addict America, The Lost Connection. So this is really about how our addictive lifestyles interfere with connection, and that's what people are seeing us for. Sex is that's the symptom. So somebody can come to me as a sex therapist and say, well, we're not having, one person's not having as much sex as they want in the relationship, or they're having some kind of difficulties, some kind of sexual dysfunctions. Their sexual organs aren't doing what they want them to do. So I treat erectile dysfunction, premature ejaculation, pain, sexual pain disorders. But those things are manifestations of some underlying condition that really has to do with intimacy. What people want is more intimacy. They want to be connected, they want to be close, but something is interfering with that. And that's what I address. So at the end of the day, people come through my door because I'm a sex therapist. But what I actually treat them for is intimacy disorders, attachment disorders, inability to connect, fear of connection.
I'm glad you said that because I wanted to ask you to please share with them the actual definition of addiction. Because people tend to think, oh, well, I'm a sex addict because I love sex. Loving sex doesn't make you a sex addict. So there is a specific definition for that. And I cannot say it better than you, so I will let you explain that.
Thank you. Yeah, I think I started to say that and I got distracted.
That's okay.
So the definition of addiction is obsessive, compulsive, out of control behavior done in spite of negative consequences to self or others. Okay, obsessive, we're thinking about it all the time. Mm-hmm. Compulsive, you're doing it, even compulsively doing it. Out of control, so you're not in control of what you're doing when you're doing it. You're doing it when you say you don't want to do it. You're doing it more than you say you want to do it. It's whatever it is you're doing. And then it leads to negative consequences, self or others. And the biggest negative consequence is that disconnect. The disconnect from yourself, from your own being, from who you are. The disconnect in your relationships. And then the disconnect from your higher power, from God, from whatever you conceptualize something that's greater than you and our place in that universal life force, our place within whatever our spiritual practice is. Addiction disconnects us from that. And again, it doesn't have to be any one thing. It can be anger, it can be drama, it can be everything, because we change our brains. Addiction changes our brains to need more and more and more stimulation, until just regular things that make us happy or excited don't even register. We raise it to needing more and more and more, and so we're going to grab that stimulation from wherever we can get it. And there's still usually a drug of choice, although recovery from addiction isn't about just abstaining from a drug of choice. It's about really changing one's life, because if you abstain from one drug of choice, you're going to choose another. You're going to keep. So your life is still going to be very out of control, and you're going to experience those negative consequences. So what we're talking about here is how to live in recovery. You know, what's happened to your brain, because it's not a moral failing. Mm-hmm. There's actually a brain process that happens and changes our brains. And so this talks about what's happening and how can we turn it around.
You know, one thing that I learned from you that I never forget. So I met Dr. Clark in one of her classes when I was actually doing my bachelor's. I was doing a thesis project, and I went to visit her sex therapy institute, and it happened to be a class on sex addiction. And at that time, I didn't really know what it was. And one of the things that she said that I remember impact me is that when you're a real addict, you don't really measure the risk. So in other words, you know something it's gonna happen, something could happen, but you can't control yourself. So in other words, a good example that you gave us in that class that day is, you miss work because you're, doing something to feed your addiction, and you know that you're gonna get in trouble. You know that you could lose your job. You can lose your partner, damage your relationship with your kids, but you cannot control it, and so you do it anyway, because that's what an addiction is. Now, like she explained, there's ways to treat it, and there's ways to still be an addict but not being acting on it. Is that the right way to put it?
So we want to look at living in addiction or living in recovery.
Right, exactly. So in other words, if you are an alcoholic, you try not to go to a bar, because that's gonna put you in a bad place, but there's always gonna be alcohol around, so you just manage how to live your life in a way that you don't act on it, right?
And it's more than not acting on it, because that's abstaining. That's what we call white knuckling it. I'm not gonna do it, I'm not gonna do it. That is actually providing the brain with stimulation that it feeds the addiction. What we wanna do is move it, turn away from it. So here's my addiction over here. I'm going to attend to what's over here, and I'm going to make that recovery. All the things that have to do with recovery.
Right.
So it's not just, there's plenty of sex addicts that are attending AA meetings, and they haven't had a drink in years.
Right.
But they're acting out sexually.
Okay.
They're bringing that sexual energy into whatever they're doing. Now, I want to be real clear when it comes to sex addiction, because this can be kind of controversial. Sex addiction is not about what you're doing. We're not saying any particular sexual behavior is bad or addictive. What we're saying is you can make it addictive, or you can make it okay. So masturbation to pornography. Now, you can have a personal viewpoint about that,
right,
and live by that. That's fine. And for those here in the sex therapy world, generally, masturbation is a very healthy activity. And if you use some pornography, adult pornography, okay, I have no problem with that. However, for some people, where it becomes obsessive, compulsive, out of control behavior, done in spite of negative consequences, self or others. Now we've taken what can be a healthy activity and moved it into an addictive place.
Right.
And that can happen with anything. So whatever your personal feelings are towards any particular sexual behavior, that's yours. From my point of view, it's all good as long as it's not obsessive, compulsive, out of control behavior done in spite of negative consequences, self or others. Because when it goes into that place, now we have a problem, because it's disconnecting, it's a lack of intimacy, and you end up using other people as drugs. It's you're reaching for someone external to fix something internal, and that's drug-seeking behavior, and that can be a person. So that person is going to feel empty and unimportant in the relationship, and that's often what's first lets people know that, okay, I have a problem, when their partners are complaining about it.
Right. And also, I would like for you to help me educate my audience about the difference between, for example, sex surrogacy, sex therapy, sexologists. Like those terminologies lead to a lot of misinterpretation as of what we do or we don't do. Can you please explain each of the different titles so that people understand what it's all about in reality?
So sexology is the umbrella term. It's the study of sex, basically. Ology is the study of sex. Okay, so sexology. Clinical sexology. Clinical means you're actually seeing people and treating people. So clinical sexology is something that a lot of people doing a lot of work, if they're working with people on something sexual, they can, have the title clinical sexologist. So that's your title.
Exactly.
Because you work with people and to help them with sex, you're doing it under relationship coaching, and so that's clinical sexology, and that's what you're certified in.
So like psychology is the study on human behavior, sexology is the study on human sexuality. But then it's a totally different thing, that's sex surrogacy, for example.
Yeah, and before we get to that one, I want to explain what a sex therapist is. So a sex therapist is someone who's first a licensed therapist. And so I'm a licensed therapist. I'm a licensed mental health counselor in the state of Florida. And therefore, with the additional training I have and experience, I am able to use the title sex therapist. Florida is the only state that regulates that. Other states don't regulate it. But anyone that is practicing another therapist in another state, if they're calling themselves a sex therapist, they still need to have something to give that weight. Otherwise, they're practicing outside their area of expertise. Right. So if you run into somebody who's calling themselves a sex therapist, you want to know, do they have that as their area of expertise? Do they have training and experience, even if the state doesn't regulate it? Okay, so as a sex therapist, I can do a lot of other kinds of therapy. Someone who's not a psychotherapist needs to practice within their area of expertise. So as a clinical sexologist, they can work with, different sexual dysfunctions and disorders from a behavioral place. If it turns out those dysfunctions and disorders have an underlying psychological basis, an underlying mental health basis, then that sexologist may refer to a sex therapist to deal with that. And so they're going to work together. Now, a sex surrogate is someone who plays the part of a partner when treating sexual dysfunctions. And so that person can have physical contact with the client. Sex therapists and most clinical sexologists, unless they're licensed to do some kind of body work, like a licensed massage therapist or a licensed physical therapist, do not touch their clients.
Just talkative
We
sessions.
talk.
Yes.
We
talk.
and we don't watch anyone doing anything.
No.
I don't want to see anybody naked.
Right.
But what we do is I would work in conjunction with a sex surrogate if I were trained to do so, which I am not. Okay, so if you're going to work with a surrogate, what would happen is you would have a therapist who's trained to work with surrogates. You would have a surrogate who's been trained and certified. IPSA, the International Professional Surrogate Association, I think that stands for. IPSA trains and certifies surrogates. And what they do, it's not about surrogates just having sex. They're not prostitutes.
Exactly.
They're not going in to have sex with somebody. What they're doing is we're looking at what is the nature of the problem someone's having, and the surrogate can be the therapist's eyes in that session, and can then work with the therapist to say, well, this is what was happening when we were touching, and it might be getting comfortable with your body, and so the surrogate is going to get naked, may get naked with the person. They may just be touching. They may be just totally touching, because somebody could be coming in and they're very nervous, and they don't have experience. A lot of people go through life and they don't get those experiences of touch and of, how do they do something? How do you kiss? How do you fondle? What do you do? And a surrogate is a safe person to do that with. And it's under the guidance of the sex therapist. And it might come down to they will have intercourse, but they might not.
Right.
And it's all very measured and structured and professional. And it's very useful, because what better way to practice new behaviors and to learn things than by doing it with someone else. If you have a partner, that's great, but sometimes partners don't want to do that. But surrogates usually don't work with a person if there's a partner involved. We want to bring the partner in and have a partner and the client work together on whatever the problems are. But if a client doesn't have a partner, then the surrogate is a wonderful option.
I want to pinpoint that sex surrogate, it's not legal in every state. It's only, I can't remember.
Well, it's not illegal either. Okay, it's important to know that it's not recognized.
It's not
So it's not
right.
legal, it's not illegal. California and New York, I think, are the two states that actually recognize it.
Right. Mm-hmm.
But the other states, it's really not prosecuted. There's no reason. If you're doing something, that you're doing it ethically, responsibly, and it's under the umbrella of something like IPSA, then it's not illegal. It's also not legal. It's not mentioned in statutes.
Right. But you said it right. It's not recognized. That's what I meant to say. In every state, because and for some states it's not even something that people know about.
Right.
Because people tend to confuse this with such a kind of like a escort service or something like that. These are professionals that go to school and they get trained, and it's not the same thing.
Yeah. So prostitution is, which is, and I will say, unfortunately, that's that's Dr. Clark saying, I feel it's unfortunate that prostitution is illegal, because that means a woman doesn't own her body. So you can see where that goes. Okay, the fact is it's illegal. Prostitution is illegal, and that is sex for money. Right. Surrogacy is not sex for money. Surrogacy is about having someone to practice therapy, to do therapeutic interventions with. So just like when you go to a massage therapist, you're paying for a particular service. When you go see your gynecologist, they're touching your genitals. Right. Okay. When you see your urologist, totally they're touching your genitals. Right. And when you see a physical therapist who specializes in pelvic floor work, which is really important, they're touching your genitals. Right. Okay. And it's for a therapeutic purpose. And that's what surrogacy is as well.
I'm glad that you explained that, because I feel like there's a lot of misconception in people hear what we do and they automatically think, also what you do is you have sex with your clients.
Yeah,
and it's not. It's
no,
not
and in fact it's illegal, it's unethical for us to have sex, any kind of sexual interaction with clients.
No nudity, no touching, just talkative. Yes.
Well, or non-talk therapy like hypnotherapy or EMDR or there's non-talk therapies, which
Yes.
I'm a big proponent of, because talk therapy is all about the prefrontal cortex, the thinking, reasoning, logical brain. But really, a lot of what we're doing in sexology and therapy is about the limbic system, our emotional brain.
Right.
What in my book I call the caveman brain is the limbic system, and that's the survival brain, the emotional brain. That's where addiction is.
Right.
And so there's different non-talk therapies that get back into that part of the brain to reprocess information, to deal with things that talk therapy is not going to get to.
And
so a lot of things that you can do, and I do, have to do with behavioral interventions, because changing behaviors can actually change the caveman brain.
Can you tell them about the EMDR? Because you have done EMDR on me, and I feel like it's such a great tool, because it's not like people think that you're asleep or you're not conscious. It doesn't work like that, but it takes you to somehow unconscious part of your brain where you storage possible traumas or things that are not something that you access every day, and because you don't, then you cannot treat it and you cannot work on it, so therefore you cannot cope with those traumas. So can you please explain a little bit about how does that work and the benefits, especially like sexual abuse survivor or some similar cases like that?
So EMDR stands for eye movement desensitization and reprocessing. And what that means is it replicates REM sleep, rapid eye movement sleep. So when we go to sleep, we process. The brain works behind the scenes to process the day's events, make sense of them, file it away on the hard drive. When things happen, especially when we're children or when something really big happens that our brain is unable to process, then it stays in the brain's RAM. So for those of you who are computer savvy, so you got RAM, which is the active working part of the brain. You got the of memory, and then you've got the hard drive. And so what happens is when something is in RAM, it's always popping up. It's always slowing down your system. It's active. It's like it's happening right now. And so certain traumas, and even, that we call them big T traumas, that could be something, a huge sexual assault, if, you're in a war, if you're a service person,
PTSD.
So any kind of big PTSD, post-traumatic stress disorder. But there's little T traumas. Little T traumas are, you come home when you're a little kid, you come home from school with a B on your report card, and your father says, "What? Why didn't you get an A? What's wrong with you? I know you can do better." And the father might think he's being motivating, but guess what? What do you think the little kid is hearing? The little kid is hearing, "I'm not good enough.
Right.
I'm a failure." And the kid takes that in. And the brain can't process that because he's a little kid. He doesn't have any context to put that in. And kids make everything about them. And so that gets stored in the RAM. It stays in RAM. It's always there. And then it becomes that filter through which life events pass. So anything that happens, and it's probably not that one incident with dad. That's the culture in that family. And what happens is, as that kid moves through life, he's going to hear everything through that filter and take in, "I'm not good enough." Anything that happens, he's going to be taking it to an "I'm not good enough" place. And then, ultimately, I might see him for sex therapy because he can't have an erection because he's not good enough, you see. And so EMDR, we use bilateral stimulation. So it can be eye movements, or it could be audio and tactile stimulation. So I put headphones on people and they hear stereophonic sound and buzzers in the hands that go back and forth. That provides bilateral stimulation. There's more to it. There's a whole setup but we connect with those memories. The brain will naturally go to all the memories that went through that filter, and it reprocesses it, and now it separates the emotion from the memory, files the memory away on the hard drive, and now memories can be recalled if necessary without the emotional content. But that frees us up to, instead of relating to people in present time as the child that we were, okay? So if my partner says something to me and I go to, "I'm not good enough," not consciously, remember it's back in the limbic system, so that's the unconscious brain. but I'm hearing I'm not good enough, and so now I'm responding as a little kid to a partner, to a boss, to a friend. Once we do the EMDR, now I can respond as an adult because I don't have that message weighing me down. And now I can communicate from an adult place, and I can connect because I'm no longer fearful of being in an intimate relationship. Because there again, those I said sex can be the symptom of relationship issues, and addiction interferes with relationship. And what happens is these memories from childhood, with that message, I'm not good enough, I'm not important, I'm worthless, those get stored, and then that forms a fear of connection and intimacy. I certainly don't want to get close to somebody if they're knowing that they're going to think I'm not good enough. And so I'm going to keep a barrier to intimacy there. And I talk about that. I have somehow Illy will make this available to you. It's a little article I wrote called Intimacy by the Numbers. And so, I came up with this idea that we have we get together, have an equal fear of intimacy. And so when when I was out looking for a partner, I would look for someone who has the equal fear of intimacy that I do. And then we kind of stay there, but we really want to be connected to other people. So we get close, we want to be more connected with prefrontal cortex, but then the limbic system makes that fear. So we got this push-pull thing going. And we have to resolve that problem, and we can do, one of the ways I do that is with the EMDR. So that way we put all that old stuff to sleep, put it back in the hard drive. So now we're capable, but of course it takes both people to do that. So if you have one person that is becoming capable of being closer to another person, but the other person's not doing their work, then now you get people, you got that chasing thing, and that's not going to be real effective for that particular relationship. But when people are talking about, how come I can't find somebody, or how come everybody I always find has this problem, it never works out? Well, this is why. There's some work that you need to do to resolve those past early childhood traumas. And when you do that work, it'll just open up your energy to now attract people to you who are going to be capable of the level of intimacy that you are.
Thank you. I like that, because I feel like relationship starts within, and then in order for you to have a healthy relationship with someone, you have to have a healthy relationship with yourself. So treating past traumas is super important in order for us to be healthy and welcome that relationship that we want to build. Since we talk about your background, I wanted to ask you, so you can tell the audience, what are your type of clientele? Like, people think, okay, so who is the type of clients that request your service? And what are the benefits of really going through therapy? I mean, we all know about therapy, but what is the big deal about doing this? What about if I don't do it and I have this trauma for the rest of my life, and hey, if I don't talk about it, I don't feel it, so I don't have to deal with it. Can you tell me a little bit about that?
Then you're going to be very lonely.
Yes.
Even in relationship, you're going to be lonely.
Yes.
There's going to be this sense of something's missing.
Right.
My clients are people, a lot of them are sex addicts. They identify as sex addicts. They're coming in saying they're doing some kind of sexual activity, behavior that is obsessive, compulsive, out of control behavior done in spite of negative consequences to self or others. And so that's when they walk in my door. Now, sometimes they walk in my door saying, I might be a sex addict. And honestly, hey, I don't push it on anybody, but if you're asking that question, you probably are. And that's when I give the definition, and they'll say, yeah, okay. Whether or not you actually identify as an addict, living in recovery is good. It's like, so whatever you want to call it, it's still, addiction is about disconnection. It's about not being present. It's about reaching for something external to fix something internal, that I'm not good enough. You see, it comes back to that. It's, it just takes over your brain. It takes over your life. Okay. Recovery is about being present, connected, capable of connection and intimacy, aware of connection and intimacy. enjoying life in the present, not worrying about things you can't change. I love the serenity prayer.
Yes,
God, grant me the serenity to accept the things I cannot change. That's basically everything outside myself.
Mm-hmm.
The courage to change the things I can. That's me. And the wisdom to know the difference. And so wait, just, you know what, Jasmine, get in here. Jasmine, come here. Come here. You know what? This is perfect.
We have somebody else coming. This is
because
great.
Jasmine just walked in. We're doing an interview.
And this is Jasmine.
This is Dr. Jasmine Maramon.
Yes.
Who is also one of our graduates. She got her doctorate with the program.
Yes, great program.
And Jasmine has gone on, because you can tell if you picked up on her accent, she speaks Spanish. She has a Spanish accent. I'm surrounded.
Yeah.
That's Miami. We're all
Welcome to
Spanish,
Miami.
right? And so Dr. Jasmine Maramon is now teaching the program, the sex therapy program, in Latin America.
In Spanish.
In Spanish.
So we all can get it.
Yes.
So
So I'm glad that you just walk in our talk show. Welcome.
Yeah, yo quiero bring a gift to wish you Merry Christmas and Happy New Year.
Thank you.
Don't you love this
This
TV
is
show?
fun. Sure. So we're going to be on the
On the talk show.
on this talk show
Yes.
that Illy's doing.
Great.
Did you ever meet Illy?
Yes,
Okay,
yes,
yeah,
we
yeah,
did.
of course
we
you
did.
did. Okay.
Nice to see you.
But thank you, Jasmine.
Okay.
Yeah. See, that's what you got to do. You got to be flexible.
Yeah.
And instead of like
We
Freaking-
improvise.
we
That's great.
improvise.
Okay.
We started with one guest and then we have two. That's awesome.
Merry Christmas.
Merry
and,
Christmas.
It's all good here, so listen carefully.
Lots to learn here.
All right. Bye-bye, Jasmine. Thank you so much.
Bye.
Thank you. Well, that was fun.
Yes.
That's what happens when you're
That's-
doing live.
That's what happened.
When you're doing something
yes,
live.
which is great.
So I was talking about who I see in therapy.
Yes. And the reason that I ask you that, it's because in my experience, I get people that come to me and say, well, I want to see you because I have sexual dysfunctions. And later on, I learn, and of course I learned from a mentor, that a lot of times it's really not a sexual dysfunction. It could be anything from disconnection. It could be either a medical condition that requires medication, and then medication leads to low libido, or it could be also low self-esteem, body image issues. I mean, it could be so many things. And if there is a message that I want to put out there, is that sexuality, it's not specifically talking about intercourse and orgasm. That's not it. It's about the connection. It's about using our five body senses simultaneously to reach pleasure, but pleasure does not need to go to an orgasm, because then that will put a pressure on what we have to perform. And then you see people like us and it's like they expect a choreography or something, right? So it's not about that. So I'm glad that you were explaining that.
Yeah. And we had a light that just went out, but you know what? It's fine. It's fine,
it's
because
good.
now I was getting blinded. And you know what? I can see that we're perfect.
We
we're
don't need
lit
sunglasses
beautifully.
anymore.
Yeah. One of the things that what you just said bring up is something else that I say a lot, which is that a lot of times couples come to me because they want better sex. They want to get their sex lives back. They're trying to use sex to be intimate. They want to use sex to feel that intimate connection. And what I do is I ask them to turn that around. And I've never had anyone say that doesn't work for them. I ask them to turn it around and say, let's build intimacy. Let's acknowledge intimacy. Let's grow that intimacy. And then sex becomes one way of expressing that intimacy. Does that make sense? So it's a way of expressing intimacy out of many ways. And so when you're saying we don't want to put pressure on people to have orgasms, we don't want to put pressure on people to have erections.
Right.
We don't want to put pressure on people for anything, because
at all.
when you're connecting in order to express intimacy that already exists, then anything is wonderful. So there's emotional intimacy, there's affectional intimacy, intellectual intimacy, social intimacy, physical recreational type intimacy, spiritual intimacy, and sexual intimacy. Aesthetic, I know I forget one. Aesthetic, and so we're enjoying art or music. Those are all ways that I encourage people to build their intimate connection. And then sex becomes one part of that. And then it doesn't matter what you're doing or how you're doing it, because it's about two people sharing their bodies in an intimate way because they're feeling intimate.
So in other words, it's not really about the act of having sex, but connecting at a deeper level. And believe it or not, some people are in a relationship for many years, decades, and then they want to go back to what it was before, but then it's like, so are you doing the same things that you were doing when you were dating? No, my life is totally different now. So it's more about taking it back there, go dating, talk, relearn about your partner, because I mean, I'm certainly not the same person that I was 10 years ago. And when you're married for 20, 30 years, that will happen. So instead of focusing on intercourse, what about if we take our intimacy to the next level, where we can express each other, where we can have pleasure and pleasure each other, but in a different way, maybe taking the genital zones out and more being like in tune with each other, our spirituality, communication, have fun. I mean, this doesn't have to be that complicated and work. It's not a workout.
Yeah, and we certainly don't want pressure. We don't want performance. We want to get rid of the word performance.
Pressure,
it's not a performance.
yes.
Performance makes a disconnect. It makes a power and control thing that now we can't connect.
And then it gets worse because you feel the pressure.
So I think you're all probably getting the idea that this is a huge topic. It's all-encompassing, whatever you thought it was. Hopefully from our talk today, you're realizing that it's a lot more things. It might be different things than what you thought. It might be more. And maybe you already knew all of this. And so, yeah, you. But I really enjoyed this. And
I'm glad.
I'm hoping that whoever is watching this, you ask us more questions, and we'll be happy to do more interviews and answer your questions, and because there's just so much information to give.
It is a lot,
and
it could be an everyday different topic, subtopic within the topic. I mean, it never ends. When I post this video, I am also gonna add Dr. Clark's information, so feel free to contact her if you wanna find out more about the book, about her programs, about her services, or any question that might come up after you hear us talking today. So I am so glad that we did this interview. I mean, she has been my mentor for over 10 years, and then her mentor, it's also a good